National Lung Cancer Awareness Month. Did you know that lung cancer is the most common type of cancer and the leading cause of cancer deaths in the world?
I didn't know that.
I didn't know
Did
that
you?
either.
Well, thankfully, UConn Health is on the forefront of a new kind of AI technology when it comes to diagnosing and treating this disease. And I had a chance to learn all about it. Take a look.
Our best chance to potentially cure lung cancer is when we identify it before we even know you have it.
Lung cancer is far too prevalent here in the U.S., and a majority of people associate the disease with smokers. But did you know that 10 to 20% of those who develop lung cancer have never even smoked before? Typically, the warning signs of lung cancer are things like a persistent cough, unexplained weight loss, and a family history of the disease. And the criteria for standard lung cancer screenings, you must be 50 to 80 years old with a 20-pack year history.
So 1 pack per day for 20 years or so, or however the math works out there. And then they haven't quit smoking within 15 years.
Dr. Omar Ibrahim of UConn Health says since the technology has gotten better, so too have the options for treatment.
When we do a biopsy, we send that for the DNA of that tumor. So this way we're treating that tumor for that patient and not necessarily a blanket approach of this is how we treat lung cancer with this medication.
And now there's even more help when it comes to identifying, managing, and treating patients with lung cancer.
What we've taken it upon ourselves here at UConn Health is to kind of look at what's available out there to help our population.
About 6 months ago, UConn Health partnered up with a software company called Optellum.
So Optellum has a software where they'll look at every CAT scan done every night at UConn Health,
irrespective to age. And this special software, which utilizes AI technology, can really help with early detection in a way like never before.
It'll look for any CAT scan done for any reason. So if a CAT scan's done in the emergency room or a CAT scan's done in the hospital for a completely different reason, it'll pull those patients into essentially a list. And within that list, what we do is we'll siphon through it, identify the nodules that we find concerning, and then we'll assess that and give them a score.
Once the doctors know what that score is, they can communicate that information to the patient's primary care doctor, and whoever else should be in the know.
And then we come up with a plan, what works best for that patient, whether it's observation or potentially going right to a biopsy if we're that concerned. The software has really made it easy for us to be able to identify this and make sure that we're catching as many, if not all, the patients as early as possible.
But here's the thing. Just because these nodules are detected doesn't necessarily mean things have to move fast.
The vast majority of the time, we don't have to act upon it. We're just observing, and we want to make sure that they either stay stable or potentially even go away.
And this AI software UConn Health has implemented is giving their patients a front row seat to their own health.
When you can find it early, you can cure it. Right. So I think that's where we're moving towards as a society.
And for Dr. Ibrahim and his colleagues, it's another tool in their toolbox they can use to provide the very best care.
It's an exciting time for medicine, and I think that, we're trying to, here at UConn Health, be in front of that. And so, when things like this come up, we jump at the opportunity to really lead the way.
Well, to learn more about UConn Health or to schedule an appointment, please visit health.uconn.edu.